She was just 14, complained of low abdominal pains. Everyone thought it was appendicitis, but the truth was much more complicated. Hi, welcome to the first episode on the series Patient Case Files with Dr. Happiness. In this series, I will walk you through my experiences of over 30 years as a medical doctor with patients. Some of the stories are very complicated, some are intriguing, some are weird, but at the end of the day, you have lessons to learn that will help you understand medicine and understand life. The lessons you learn here can help you save a life tomorrow. In today's story, it is about a teenager who complained of low abdominal pains for about 3 days. She was also vomiting. There's no diarrhea and no fever. The mother has tried to give her all that she knew in form of medicine, but she wasn't improving. So she brought her to my clinic. When I saw her, she gave me the stories I just told you now, and my mind went straight to acute appendicitis. I tried to ask her of her last menstrual period. She was vague, she couldn't remember. And then her demeanor was very disturbing. I proceeded to examine her. Her vital signs were stable. She had no fever. On the examination of the abdomen, the right lower abdomen was tender. There was pain there. I thought of acute appendicitis. But the girl's demeanor, remember I said she was 14, was very disturbing. So I decided to do a pregnancy test. Behold, the pregnancy test came out positive. She was pregnant. Now, because of the pain, that was very unusual, I decided to order a pelvic ultrasound. What the pelvic ultrasound results showed was very disturbing. If you have found value, like and subscribe. Let's go on. Pelvic ultrasound revealed a ruptured ectopic pregnancy of the right fallopian tubes. Ruptured ectopic pregnancy is an emergency. Pregnancy is supposed to be in the uterus after fertilization and not anywhere else. This one occurred in the fallopian tubes and remained there. And because the fallopian tube is very small, as the pregnancy was growing, it could not contain it, so it had to burst or rupture. And the girl was bleeding. Without knowing it, she was losing blood. We had to rush her straight to the theater. An operation called salpingectomy was done. Bleeding was controlled. We managed to save her life and save her uterus, but she lost a fallopian tube because the tube has to be removed. What's the lesson in this? The lesson here is for all of us, parents, teachers, and doctors alike. As parents, we should be on the lookout. We should start early to give our kids sexual education. We should have open communication with our children. Our children should be close to us. And as doctors, we should be more vigilant. We should not judge a book by its cover. We should communicate in ways patients will understand. And we should not be judgmental. Now, for the young girls and boys alike, remember that once you have intercourse with a man, you can get pregnant, as long as you have started seeing your menses. This teenager just started seeing menses about a year ago, at 13. And she has lost a fallopian tube. If that ectopic wasn't caught on time, she could bleed to death. If that ectopic wasn't caught on time, she could collapse. And now she has one tube left. She has to be extremely careful with it. Because if something happens to the second tube, then she will not be able to conceive naturally. With the one tube left, if she doesn't get infection or all other factors are normal, she can have as many children as she wants with one tube. Parents, be close to your children. Teachers, teach children sex education in school. Parents, teach your children sex education at home. And doctors, always do good examination of your patients. Don't just take them by their word, because physical examination can reveal a lot. So also the history. History taking is very important, as well as physical examination and laboratory investigations. If you found value in this video, please like, subscribe, and share to people you think might find it useful. And keep in touch next Sunday, when I'll be bringing you another real-life story that will blow your mind. I am Dr. Happiness, your friend in health and wellness. Together, let's build healthier and happier families.